Obsessive compulsive disorder, also referred to as OCD, is an anxiety disorder. Have you ever seen a picture hanging on a wall and it was a little bit crooked and you felt the need to straighten it? Or as you were walking out of the house, you couldn't remember if you turned off the stove and had to go in and double check? Everyone experiences these types of thoughts. However, imagine that you couldn't go over and straighten that picture at that moment, and all you could do is think about how you had to straighten that picture. You become obsessed to the point where you start to feel discomfort, like if you don't fix that picture, something terrible is going to happen. You eventually go over to the picture and straighten it so you could relieve that discomfort. That is a form of OCD. What about the stove? Imagine you go in and check the stove and see that it is turned off, but you feel that you have to walk over and turn the knob just to be sure. But before you walk away, you feel that maybe you didn't turn it off all the way. So you turn the knob again, and yet you still feel unsure. And you do this over and over again until you feel that you have completed this task and turned it off. People who suffer from OCD become fixated on certain feelings, thoughts, concepts, and/or perceptions, which drives the person to do compulsive or repetitive behaviors to remove the obsessive thoughts and discomfort. And some of these behaviors interfere with how they live their daily lives. People who have OCD try to obtain a feeling of orderliness, cleanliness, or a sense of balance. The cause of OCD is unknown, but OCD could be triggered by a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Psychologists have found that patients who suffer from OCD don't feel a sense of completion when they have finished a task, or don't know when to stop an activity, and they usually don't trust their memories of completing the task. In order to be diagnosed with OCD, the person must have at least an hour per day of obsessive and compulsive behavior which causes dysfunction of their lives and/or extreme distress or anxiety. OCD can be treated with antidepressant medication, which affects the neurotransmitter in the brain, which can decrease the frequency and intensity of the obsessions and compulsions. Typically, cognitive behavioral therapy is used to help treat OCD. The patient voluntarily faces the object or idea that causes them to feel anxiety or fearful, and either with direct or imaginary exposure. With support from a psychologist and/or family and friends, they are encouraged not to give in to the compulsion for a long period of time, and gradually they learn to manage the anxiety and be able to refrain from conducting compulsive activities. This therapy is most effective when it's combined with medication.